You talk about making believers, value based believers. One of the ways to make value based believers is to align the incentives. So, talk about aligning the incentives.
Absolutely. And again, we always lead with our providers and our clinical teams in particular. We lead with the fact that what you're doing is better for your patients and better to get outcomes. But as you said, it never hurts to have your incentives aligned with that. And so we do have something called the Universal Provider Incentive Program. We call it UPIP for short. And so every single specialty has the physicians have 20% of their compensation tied to value-based outcomes, including quality measures, patient experience, enhanced access, and then accurate disease burden capture. And so we have this for every single specialty, whether you're a dermatologist or a pediatrician or a behavioral health specialist. But in particular, for our primary care physicians, we wanted to really move that one step further and tie panel-based outcomes and performance and its impact on our value-based contracts. And so with our vendor partner, who really helped us iterate on this, we came up with a couple of bonus measures for our primary care physician. One related to risk-adjusted admissions per thousand, because again, if you can not only take care of the patients that come to see you regularly, but also don't forget the patients don't come and engage with them, bring them in, make sure their chronic conditions are managed, you're going to keep them well healthier and out of the hospital. So one measure was the risk-adjusted admission per thousand, and the other was a quality impact score, which took some of our major quality measures that our payers are holding us accountable to, such as cancer screenings and immunization rates and chronic condition management, diabetes and heart disease. And we took their panels and we saw what was the impact of their performance on each of these quality measures on our value-based contracts. So it took into account the size of their panel as well as the difference in performance for their panel compared to Summit's overall performance. And so with these elegant measures, we were able to give primary care providers data that shows them how well they do on their panel, how it impacts their value-based contracts, and how then secondarily it will impact their incentives.